Go ahead.
Hi, I'm Joyce Hodgins and I'm a public health nurse with Ottawa Public Health, and I'm working on a project with the RNAO which is giving nurses and other healthcare professionals the tools to intervene with clients and ask them about their smoking status, and if they are smokers, then to offer them some support in the process of quitting.
So how successful could a nurse be in helping a person quit smoking?
Well, the research has shown that even a brief intervention of 3 minutes or so when you meet a client, you can start the process of getting them thinking about quitting smoking, and at the very least tell them that you're there to provide support if they're interested in quitting, and pointing them in the direction of either community resources or the opportunity to come back and speak further. So the hope is that by giving nurses and other healthcare professionals the confidence to do those brief interventions, that they will take that step, because all of us, we know that most smokers want to quit smoking, and often it's just that first step of saying, we have information that can help, and when you're ready, we would like to provide you with some support.
Maybe just describe that first contact that a nurse has with a patient, and they want to, they understand that they're a smoker, and that first contact, how important is that first contact?
Well, the first contact, and that's what's the fabulous thing about nurses, is that they interact with clients in a vast variety of settings. So in the hospital setting, in outpatient settings such as a community health center or a family health team. They also see nurses in public health programming. So nurses interact with clients in many opportunities. Some of them are when a client is ill, and so it may be related to their health, their immediate health, that they need to talk about their smoking cessation, but maybe it's just in a preventive, a display, or working in a school with youth or whatever, that you take the opportunity to ask if people use tobacco and ask if they'd like support to quit. And it's always important because it's their decision if they choose to try to quit, and you're there to be supportive and non-judgmental. You're just making them aware that it is important for their health to quit, and then to ask if they would like support.
So what are some of the tools you're going to equip nurses with here today? Well,
today we're going to tell them about brief interventions. So that's asking about tobacco use, advising that it's to the benefits of their health to quit smoking, to assess whether they're interested in quitting smoking, to advise them of what they could do to quit, and then to arrange for follow-up if they're interested.
Good, and I guess just finally, from the research or from what you know, how significant is that first contact with nurses when someone, they're a smoker that day, and then down the road they end up quit smoking? Do you get feedback from people that says, it was that first point of contact that really started me on a path to quitting?
I don't really have an answer to that question, but I know that people try to quit probably several times in the process of quitting smoking. And I think the message coming from the nurse, but also coming from other healthcare providers, so if their doctor talks to them about the importance of quitting, if the pharmacist, if their dental hygienist, if the dentist, once they hear all these health professionals giving them the same message, then all of a sudden it's like, okay, well maybe this is kind of important because everybody is talking to me about the importance of it.
And I guess the final question could be, this provincial organization, Ottawa Public Health, health professionals around the province and the city, can you give us a sense of just how seriously getting people to quit smoking is taken? Like, how big a problem is this when you go to look at helping people?
Well, we know in Canada and in Ontario, we're still looking at 19% of the population that are smokers, and so that is a large number of people that still have the health impacts related to using tobacco. We know that 50 or 60% of people are interested in quitting, maybe more than that. They make quit attempts, so we know that it's something that people want to do. And with the RNAO project, where they have been going across the province, across Canada, doing these workshops with nurses, I think there were over 500 nurses attended these workshops in the last couple of years. So that has given those nurses, and then they take that back to their organization and spread the word with their colleagues. So we're seeing more and more people given the skills and the confidence to do those interventions with their clients.